Hello, my name is Christina Nijas, and I will be presenting the Unit 11 Synthesis Project. My subject for presentation is comparing comprehensive fall programs to standard fall programs. The reason being, falls among older adults in long-term care facilities represent a significant health concern, and these concerns are often leading to serious injuries, decreased mobility, and increased mortality in older adults. In residents 65 and older, 30 to 50% experience at least one fall in a long term care facility, and 12 to 40% experience multiple falls, according to a study by Lee and Kim in 2017. The focus of this project will be determining the impact of a comprehensive fall prevention program being implemented on residents in a long term care facility. The practice problem I came up with is how do comprehensive fall prevention programs compare to standard fall prevention strategies, reducing fall incidents in long term care facilities over 6 months? This was inspired by a lot of the literature that I found during research. According to Fonda et al. In 2006, before comprehensive interventions were implemented, the prevalence of falls in facilities were consistent with national averages, where approximately 50% of long term care residents experienced one fall per year, and with many other residents experiencing more than one fall per year. Preventing falls is crucial in the aspect of well-being of residents in these settings and to address significant health factors that I already had mentioned in the introduction, health concerns being serious injuries, decreased mobility, and increased mortality. The development of my PICO question was actually inspired by my current role as a case manager. I oversee residents in long-term care facilities that are under our Medicaid program. And something that I noticed when I travel from facility to facility is just the amount of falls that these residents experience. And I noticed that a lot of the facilities had only implemented standard fall prevention programs. And that I noted when I was creating my own care plans for our members versus facilities that utilize comprehensive fall prevention programs. And with that being said, my PICO question is for residents with cognitive deficits in long term care facilities, the implementation of a comprehensive fall prevention program compared to a current standard fall prevention strategy to reduce the incidence of falls over a 6 month period of time. And my target population are males and females in the long term care facility without cognitive deficits between the ages of 65 to 85. When searching for research studies and scholarly literature, I utilized the PubMed, EBSCOhost, and CINAHL databases. I also utilized Google Scholar. I kept my terming at Boolean and using keyword searches. I read a lot of the abstracts, followed by an extensive review if the abstract met criteria that I was looking for. And a lot of the results were random controlled trials, meta analysis, quantitative and qualitative review, and systematic reviews. Overall, I came up with 12 quantitative studies and 7 supportive studies. During my synthesis of the literature, I noticed a few patterns and themes that commonly emerged, and those themes noted multifactorial interventions. So, just utilizing more than one intervention for a fall prevention program. Staff training and education was very important, continuing education as well, and the use of technology combined with customized interventions. The effective fall programs often involve a combination of interventions rather than relying on a single approach. And that's something I also noticed upon my observation when I traveled to different facilities. According to Montellano and Lozoya et al. In 2020, educating healthcare staff on fall prevention can lead to a significant reduction in fall rates and associated injuries. And ongoing education helps staff remain engaged and take ownership of their roles. And I completely agree with that, especially the part on engagement. It's really important to keep that engagement going for the best outcome possible. The implementation of technology also includes, if applicable to budget, alarm systems, monitoring devices, and risk assessment tools, and the use of comprehensive screening and assessment tools to identify the residents that are at higher risk of falling and to monitor their progress. These are common themes that I noticed within all the comprehensive fall prevention programs within my research studies. And using technology to gather data will also help create these key indicators for improvement measures as we continue going through with the project on constant improvement implementation. The setting for the planned change will take place in one unit of the long term care facility. This way, we ensure there's adequate staff and observation for this project to take place. We want to implement a comprehensive fall prevention program that requires careful consideration of the environment, the staff, and its residents. And we want to have adequate preparation before implementation, and that's crucial for the outcome. The physical environment, we want to make sure that both staff and residents are familiar with the facility's layout. The areas are free of clutter, the hallways are all well lit um, and equally lit. That's just as important. There's sturdy furniture and there's handrail accessibility. Staff training and engagement is crucial. Staff include nursing all the way to housekeeping, anyone and everyone that works within the facility. We want to involve interdisciplinary collaboration. This fosters better communication to address fall risks from multiple perspectives. And we want to perform regular assessments on the residents. Staff should be performing a regular fall risk assessment for each resident, considering factors like mobility, side effects, the cognition from start to finish, and environmental hazards. We want to engage family and residents. We want to create that continuation for involvement. It's important for the residents and family to be educated on the importance of fall prevention, to include the safe practices of the project. For instance, for example, utilizing their assistive devices or calling for help when needed. And we also want the family to feel confident in being engaged as well. The process for the proposed plan change is over a duration of 6 months. The residents participating in the study will have extensive resident assessments. Customized exercises will be created depending on the member's needs, whether they're working on balance, restorative work, or all of the above. Resident rooms and common areas will be assessed for obstructions on a daily basis, and we will ensure that the residents are familiar with the layout. The team will perform frequent health assessments and provide DME as necessary, and of course within budget. And throughout the duration of the project, we'll ensure open lines of communication within the interdisciplinary team for education, feedback, and evaluations. The evaluation plan for this project will involve collecting pre and post surveys throughout the course of the study, and as well as just utilizing the data and analyzing the data. Each survey will be specific and designed to assess for staff adherence, resident and family satisfaction, and resident confidence. This will help to address any barriers throughout the course of the project and monitor for quality of life checks. We really want to make sure that the residents are also mentally not impacted in a negative way, for example, anxiety, depression. And this evaluation method will also allow us to monitor staff knowledge. It's important that the staff are knowledge and address any gaps in that education to staff, and this will help better implement that education. And we'll be doing an outcome measurement continuously. By evaluating effectiveness of the fall prevention program, monitoring fall rates, injury severity, and resident outcomes. This project will have a system in place to track and analyze falls, identifying patterns and areas for improvement. Data collection will be digital and non-digital using the TIPS bedside assessment tool for interventions, incidents, and injuries. And we will also be utilizing the TRIPS tool as well. This is for tracking, reporting, and an incident prevention system. We will be performing regular audits. Regular environmental and procedural audits should be conducted to ensure compliance with fall prevention protocols. Using the data will allow us to identify areas for improvement, identify gaps, and implement targeted quality improvement initiatives to further reduce fall risks. This might involve revisiting certain training sessions throughout the course of the project, providing additional resources, or just adjusting our communication methods. Communication is huge, and we really want to make sure that there is an understanding on both ends amongst team members. And with family as well. And the plan change is aimed towards creating a culture of safety within the long term care facility where fall prevention is top priority. By systematically utilizing the data to address various factors, we'll be contributing to allow for continuous refinements and reduction of fall rates, and that is the outcome goal. When disseminating this project's comprehensive fall prevention program, it's really important to ensure that all the stakeholders are informed, engaged, and committed to the program's success. The key stakeholders include internal and external stakeholders. The internal stakeholders include nursing staff who will implement and monitor the program, as well as the interdisciplinary team and leadership who will oversee the program's implementation and allocation of resources, as well as the supportive staff. They're important to contribute to the environmental and operational aspects of fall prevention. So, just as mentioned earlier, housekeeping and maintenance. The external stakeholders include the residents. The residents are the primary beneficiaries of the program. And the families and caregivers are very important as well as the regulatory bodies for compliance purposes. An effective dissemination plan should be systemic and tailored to different audiences to design and facilitate the adoption and integration of the program in a daily practice. Creating a detailed timeline will help the project to stay on track. And we broke the project down into 3 phases. Pre-implementation is weeks 1 to 2, and that will consist of initial meetings with all the internal stakeholders to introduce the project plan, explain its importance, and outline the roles and responsibilities, as well as conducting initial training sessions and workshops. Phase 2 is weeks 3 through 8, and we'll continue with targeted trainings and workshops and begin regular updates and feedback sessions. We'll be monitoring for early implementation to address any challenges along the way. And the remainder of the 16 weeks is sustained communication. This will allow for regular review and just an adjustment of the program based on feedback and data. And to celebrate success along the way, it's really important to share outcomes and maintain that engagement and acknowledge the staff efforts. And throughout the course of the project, we will monitor and evaluate the project efforts through feedback mechanisms, like mentioned earlier, surveys, suggestion boxes, routine meetings. Research has found this helpful to identify areas to need more attention and improvement. The goal is to develop a comprehensive fall prevention program that's sustainable. It's really important to make this a long-term outcome versus something short and not impactful. To develop sustainability, this is going to involve offering regular refresher trainings, periodic reviews of the program's effectiveness, and ongoing communication with all the stakeholders. Comprehensive fall prevention programs are great. They're awesome at addressing the complex and multifaceted nature of falls, especially amongst the elderly, providing a more thorough and integrated approach to fall prevention compared to just the standard fall prevention measures. Evidence from several research studies, including notable studies like those conducted by Fonda et al., illustrated that comprehensive programs not only decreased incidence and prevalence of falls, but also improved overall resident safety and quality of life and operational